Mm-hmm. Do you see the tissue line?
Look at
I'm looking at the PowerPoint.
I think it's this one. Oh, okay.
What
I know it's
PowerPoint?
really dark.
Your PowerPoint.
Okay. So everybody has a pneumo? Know how to read it? Know how to find
Tissue
it?
line where?
I think you can see it like right here.
Oh, okay.
Sometimes they are hard to see. Because if they're small, less than 15%, the body can take care of it.
Mm-hmm.
Okay, if the patient's in good physical condition. If it's larger than 20%, then medical intervention is needed. Good?
Mm-hmm.
So what's next on the list?
Croup.
Oh, croup.
I'm recording it so I
Oh,
can
yeah.
post it. And that's how I'm trying to look at yours.
Croup.
This one. The tree thins up. Right? Is that a good one? I'm recording so that what she's pointing out so that I can post it and then we can watch it later.
Okay.
I just remember.
Okay, so croup. It's going to look like a picket fence, a steeple, something like that. Croup is usually viral in nature. So what therapy is used for croup?
Medications like what's that medication for it?
Epinephrine?
Yes,
Racemic?
racemic epinephrine
Epinephrine.
and cool mist.
Cool. Okay. And then
And
so we're
remember-
just looking for it to like look like it's going upward like a steeple, like the
It's narrowing to a point.
yeah.
That means the airway is closing.
Okay.
Yeah, that's the only way I would tell. Like somebody pinched it.
Mhm.
That's all right.
Yeah. Can you see it? Yeah. Yeah.
So the next one is going to be epiglottitis. Epiglottitis is bacterial, usually bacterial, considered an emergency situation. And it's usually a lateral neck x-ray. So what does it look like on the x-ray? It's a thumb. Do you see the thumb?
Mm-hmm.
Just go this way. Oh, okay.
It's going in inside here.
Okay,
Like,
right
it's
there.
like this, I think. Like it's going up.
And that's a bacterial infection. And so
Emergency. Do you remember what I said one of the common symptoms or sign is? What would the patient be doing? Drooling.
drooling. Okay.
That, because they could have Stridor also, meaning that they may be misdiagnosed with croup,
Mm.
but if they see the drooling, physicians ought to not, that's epiglottitis. You don't drool with croup. You only drool with epiglottitis. The treatment is intubation.
That's it.
Emergency intubation, placed on the mechanical ventilator with steroids and fluids. What's next?
Pulmonary edema.
Okay. Pulmonary edema. I'm tired. I worked too hard yesterday. You guys are wearing me out.
Cardiogenic pulmonary edema. That's where it's coming out of, like the.
It stems
Yeah.
out. It starts at the island.
Yep.
And then it stems out.
Okay.
This is
Well, that's a good one.
the other one was too white, I
Yeah.
So pulmonary edema may be cardiogenic or non-cardiogenic in nature. Non-cardiogenic pulmonary edema is usually associated with toxins, I don't know, like an anaphylaxis issue.
And then how is that treated?
Pulmonary edema would be treated with diuretics and positive pressure,
Okay.
such as your BiPAP. Now, there is an issue called flash pulmonary edema.
What's that?
Flash pulmonary edema means it happened suddenly, almost immediate. And that, again, could be caused from a toxin, or it can be from us weaning our patient off the ventilator too quickly.
Oh, okay.
And the changes in the pressures, osmotic pressures, can cause the floodgates, especially if the patient has had cardiac issues.
Oh, okay.
That's why there's a specific protocol for weaning patients that have had open heart off the ventilator. Amy, which one are you on? Are you just like scrolling through there?
No, I'm looking at the next one. For the exam, do you want us to tell you like the treatments too, or just like point out that that's at electives?
Well, I think I'm gonna ask you, well, how do you treat that?
Do we have
That
the?
way-
We just point out like how where we're noticing that it's that.
Mm-hmm.
Okay.
It's on a PowerPoint. I pull it up. It's gonna be in the classroom computer on that monitor, and I call you up one at a time. It's like, okay, what do you see here? The first one is you doing your technique
Okay.
and identifying everything.
So we have to do the technique on everyone, or just
No. Now, you should, so you'll know what's going on, because if you just say, oh, it's this and it's wrong, then you missed it.
Mm. So don't get it wrong by saying extra. Okay.
Let's see. What's next on the list?
electives?
Atelectasis. I like that word. I think that's just, oh, they're atelectatic. I think that I just sound so super intelligent, don't I?
What picture do you have?
You guys want to hear me whine again? I have another meeting today
At what time?
from 1:30 to 4:30.
No, 3 hours.
Just take snacks. Make you happy.
Some of the other instructors that have to go, they're like, gosh, what are we going to do? Because most of us were here till after 7 last night with the meetings.
Oh yeah.
And it was just like,
It was
we're
a
just
Zoom,
sissies. We're
it was a
tired.
Zoom meeting too. But you had to be there.
For ours, it was a Zoom, and then we went to, there were some face-to-face meetings that I had to go to.
Mm.
So Matthew and I left at the same time yesterday, which was after 7.
Mm.
He's like, oh, you ready to come back and do it again tomorrow? I'm like, no, I'm not. Oh, and the hospitals that did show up, the advisory committee, which was CRMC showed up, Valley Children's, Dr. Saul, and some other therapist. They're all in favor. They would be supportive of us to get the bachelor's.
Oh, nice.
I hope so.
Mhm.
Because I want to do it.
CRMC, especially if they can come in and be hired as adjunct instructors,
Oh, cool.
you know, for the higher level, the specialty events and things like that.
Mhm.
Valley Children's is like, heck yeah, we want to be adjunct.
What does the bachelor's cover for our people?
Well,
I think you said transport last time.
there was a big discussion on that. All we know, the final agreement was, yes, we support it.
Oh, okay.
But how are we going, what curriculum do they want?
Yeah.
Some want you to focus on quality improvement, performance improvement, things like that. Others want us to focus on higher level skills. The thought was, no, they need the critical thinking first, then they can develop the critical skills. And so they're unsure of which way to go. But they know that we need it.
Yeah.
Who's going to be teaching this and this and this? We don't know. You have to know the curriculum before you can decide who's going to be teaching it.
That's true.
It'd be a year, another year, year and a half.
Just another year at the max.
Yeah, I think it's just like something more units.
Was it
It's
like
only about
21?
20 more
Yeah.
units.
Yeah.
So if you guys do it, it'd be like a lottery too.
No, you can take as many as you want in a bachelor's program because most of it would be online education. As maybe a hybrid of, you have to come in to take your exam, something like that.
Mhm.
But I really want to add another track, which would be the higher level skills. Like you would come to us and maybe your hospital wants to send you and to get you certified to do lung ultrasounds at the bedside for
Okay.
endotracheal tube placement,
Mhm.
identifying pneumos or early stages of ARDS. We need them to be trained on ECMO. Okay, I can write the curriculum for it. You're going to be trained over at this hospital to do it.
Would it be the first, if approved, the first bachelor's program here? Or are there other
For
bachelor's
City
programs?
College?
For respiratory,
Or just Fresno City College?
I think she just means
dental
in general.
hygiene is going for it first.
Oh, okay.
What?
Not already? I would assume already.
And no, because there is a big political issue between the university systems and the community colleges.
Mm.
That's
See,
what
the
I thought.
university systems do not have a bachelor's program in respiratory at all. It's not like Texas, Oklahoma, places that, Texas University has a master's program. They have bachelor's and master's, and now they're developing a doctorate in respiratory. Ohio State University has a bachelor's, a master's, and now a doctorate in it.
Wow.
I'm just low man on totem pole. It's just gonna, okay, this is a stethoscope.
Mhm.
Okay, so, what are we on?
Uh,
The what?
Atelectasis.
What do you see on atelectasis?
White. The heart is more enlarged.
It's white? Do you see a line associated anywhere? Like more borders associated with it? For atelectasis, when you can look at atelectasis and pneumonia, they can be very similar. And sometimes you just have to look at the patient's signs and symptoms. Because a patient with pneumonia is going to have different signs and symptoms than one who has atelectasis.
Okay.
Okay?
Are we gonna have any of that background information?
No.
Oh, okay.
I don't expect, I'm just going over it so you understand it.
Okay.
The chest x-ray for atelectasis usually has some kind of borders around it, such as like a straight line or a border of some sort, where pneumonia usually doesn't. It's just kind of fluffy.
And then the treatment for that one?
What do you think? It's atelectasis. Come on. You learned it this semester.
My brain's not working today.
lung expansion therapy for atelectasis.
Okay,
Easy PAP and IS.
yeah.
Because atelectasis is what? Collapsed alveoli. And what's the next one?
Pleural effusion.
Good old pleural effusion.
It kind of looks the same.
I think pleural effusion is the easiest one.
It
That's
is.
the one with the meniscus.
Yeah.
It's the one with the meniscus, and it blunts what? You can't see the costophrenic angle.
Okay.
Mm-hmm.
So how would you treat that?
Diuretic?
No,
No?
touch it. Pleural effusion means it's in the pleura.
Okay. Oh.
It's usually due to an infection. So it is with the thoracentesis. That's the needle with the large syringe, and they can pull out 1 liter at a time.
Okay.
Okay, or if it's a large pleural effusion, they'll put in a chest tube and just according to gravity, just let it drain. So what's the difference between a pleural effusion and an empyema?
Is it the fluid? Empyema is thicker.
Very good. Where's all my stuff at? I had all the Delmy stuff. Okay, so what's next on the list, Amy?
ARDS.
ARDS.
It's a good picture.
ARDS is
For this one?
what?
Acute respiratory distress syndrome.
Okay.
And then when you, is when you said that it's like cotton balls almost.
Stretched out.
Sand.
Stretched out, yeah.
Is that what I said about ARDS?
Is that the stretched out cotton ball?
All over the place.
Mm-hmm.
ARDS usually starts from the periphery and goes in towards the center. Or pulmonary edema is the opposite. What do you have for ARDS on there, on your pictures? Do you see some that are just totally whited out?
Mm-hmm.
Mm-hmm.
Yeah, it does look like cotton balls stretched out.
That is horrible. That patient's almost dead.
Mm-hmm.
Because all that thick white means that the alveoli are not allowing gas exchange. So where are the lungs? What's working right now? Nothing. Is that a COVID picture? Or is it just ARDS?
It doesn't say. It doesn't say.
Because COVID x-rays, patients with the COVID pneumonia were coming up looking just like ARDS. That's how bad, I don't know, what do I want to say, how bad it was with the lung tissue. So what is an air bronchogram? That is when you see the airways, and you should not see the airways on an x-ray. You guys see it? Mm-hmm.
Look at the picture. Oh, okay.
So that means that there is severe fluid or atelectasis or an infection that is taking up all that alveoli and is making the airways show up on x-ray.
Wow.
Not good.
That would be painful. And how would they correct that? Would it just be like,
Depends on what's going on. Is it fluid or is it pneumonia or what is it? And sometimes what you'll see is on an air bronchogram, say, let's just say like right here. Or let's make it up a little bit. Say if it was here and you didn't see any of this, that would be a plug.
oh, okay.
So you go down to where you see all the air bronchograms. Yeah, never mind. Just never mind. I'm going off on a tangent. You should know. Get it in your head. I'm tired. I know you guys are tired. Are you guys tired of hearing me yet?
No, not yet.
Okay, so you have your air bronchograms. What else?
What's it?
Is that it?
Proper vesicle placement.
No, we're not doing that.
Oh,
We haven't
okay.
even finished lecture on that.
I was just looking at those yesterday. Well, when I looked it up though, the ECG and then the proper 12 lead, they looked about the same, no?
Hmm?
The placements?
They're all the same.
Oh, okay.
Oh, it says tubes.
So you'll have to identify an endotracheal tube.
Oh, okay.
Oh, okay.
Okay, there's an endotracheal tube, which, okay, is the endotracheal tube placed appropriately? Okay, well, I have to find the carina, which means I have to do a T4, T5, so you're gonna have to do that, you have to count. And then, I have to also do the 45-degree angle with the aortic arch.
And for abnormalities. Is
Abnormalities.
it just like if the heart is like bigger or shifted
Yeah.
or?
Oh, it's pushed this over. Oh, look at all those lines. Look at that. They're not centered or whatever.
And that goes when we're doing our like ABCs on, will you tell us like
Oh, yeah.
which ones? Okay. That was the,
AT tube.
okay.
And, it
And
should
then you
be
count
between
the
That's your
T4,
ABCD.
4,
T5.
5, yeah, and then you go to the arch of aortic arch
Which is
right here. Yeah.
here.
Yeah, and then
It should be
do it
above
at an
it.
angle.
Showing the first year
Yeah.
students a intra-aortic balloon pump. And it's a device that's used to help with the contraction of the heart. And they place a catheter from the femoral vein, artery. And it goes all the way up the thoracic artery into the aortic arch.
Whoa.
So it's a very long catheter.
Yeah.
And it has a balloon on it. And it inflates with helium and then it will deflate.
Why all the way down here though?
Is that the
Because
closest
that's
way?
the safest area and the largest for a direct path to the aorta.
Okay.
Yeah, the first time I pulled one because